Hey everybody, and welcome to the Connect Show. In this next episode, I'll be speaking with Raelene Clark, one of our board members, who will be talking about a project and an initiative that the association is undertaking, led by herself, in increasing referrals from GPs. We've also got John Gibbons giving some tips on mobilisations for the thoracic region. I hope you enjoy the episode. Stand by.
In this video, I'm going to show you two ways of mobilizing the thoracic spine. First of all, I'm going to start with the upper T-spine, and we're going to get the patient to place his arms almost like in a cross position here, and then place his arms towards his forehead. So let's do that one to start with. Okay. And then I'm going to then bring my arms through onto the base of the neck around the C7-T1. Use your fingertips onto the upper part of the T-spine, and then just watch your own position in here. So I tend to have one leg forward, one leg back, and I'm going to bring him forward towards me. Okay? Just make sure that the couch is stable when you do this, because the lighter couches have a tendency to tilt when you get the patient to sit towards the end. What I'm going to do here now is use my fingers, and I'm going to just bring him towards me as I mobilize into extension. Doesn't look like you're doing that much, but it feels quite comfortable and quite effective for the patient. So from a flex position of the opening of the facets, I'm going to use my fingers here, and I'm just going to apply pressure and encourage with mobility some extension exercise. You can also tell that the mid-thorax is flexing and extending as well, but I'm trying to just focus on here. And I can also use my arms and increase the extension towards that upper T-spine. It's hard to say how long we do it for. I tend to do it for 1 or 2 minutes until I feel we have a change to the tissues. Just watch the patient's neck. Okay, the patient's neck, in that sort of position. Now the second one, I'm going to use a pillow. If a man is working with a woman and vice versa, then I suggest we have a pillow to separate the contact, even though we still contact in. So a pillow here. So I'm going to drop down to the patient. Their arms are going to come over like this, and then my hands are going to come round to the mid-thoracic spine, fingers either side. So there's the spinous process is, my fingers either side of a gully. And then what I'm going to do here is I'm literally just going to allow my patient to flex, and then I'm going to stand up and extend. So my fingers, I can start upper lumbar, lower T-spine. So we can start in flexion, use my fingers, so I'm literally using my fingers and traction in as I'm extending the patient. So I can drop, and then I can work up the spine. So I'm almost standing, so I'm squatting or half squatting and extending through. Okay, because it is quite physical between what you are doing. Okay, but get used to it, if you are a therapist and then you are passively mobilizing the patient, then it is quite manual intensive. From here, what I'm going to do, I can do a couple more things. I can have my hand one side, my fingers here, and I can cause like a side shift where the spine is side bending to the left, the facet joints are opening on the right and closing on the left. So it's a nice little mobility exercise as we do this. To do the other side is not so easy. I can do it, okay? Just watch your back as you're doing this sort of side shifted across here. So I can side shift one way, side shift. And then I can also use my fingers on a gully on this side here, and I can then rotate and mobilize. Rotate. This is controlling. My opposite hand is doing, because I can use my fingers in a gully with a t-shirt on is better than directly onto bare skin, and I can mobilize him through. If I want to do a rotation on the other side, it's easier for the patient to then reach on the other side. Okay, so I quite like that one, especially with a pillow between you and them. I still, even if I was working on a man, I still use a pillow because it gives you that bit more comfort between the two. And these are very nice techniques to encourage mobilization to the thoracic spine.
G'day folks, Dave Sheehan here from Connect. I'm very excited today to have Raelene Clark with me, who's one of our board members. And Raelene's got a really interesting project on the go, which has the board's backing. And it sort of focuses in on what we're doing with our strategic plan, which includes looking at pain and the benefits of massage. Welcome, Raelene.
Hey, Dave, how you going?
I'm going very well. Really excited to speak to you today because there's a lot going on in this year, 2021, with a focus on pain and the benefits of massage. So as I just mentioned there, we talked about how within the strategic plan, we're looking at a focus of bringing massage and myotherapy to top of mind to GPs. And for a couple of years, we've had a partnership with Tonic, which is partially owned by the famous now Norman Swan, that brings brochures and other media into GP clinics throughout Australia. So that's been a great initiative that we've done on as far as an association. It's still running, although with COVID around, all the brochures, all the media has been taken off the shelves all over Australia for obvious reasons. And we're looking at other ways in which we can, I guess, push that whole massage myotherapy barrow out into the space of GPs. And Davey, our new CEO, is developing relationships with Pain Australia. And we're currently, as an association, developing fact sheets around the benefits of massage around pain for Pain Australia. So those fact sheets will be placed on the Pain Australia website a little ways down the track, which is a fantastic initiative. So that's for the general public. That's education for the general public about the relationship between massage myotherapy and chronic pain sufferers. So that's a great thing. On top of that, your initiative, which is the RACGP project, we're all very excited about. I'm a part of with you. And we've got President Andrew Gallagher also backing it, along with national boards. So firstly, did you want to sort of explain what the acronym stands for and just talk a little bit about the project itself?
Well, it's the Royal Australian College of General Practitioners, and it's essentially their continuing education program. So we've got our CPE program that we, as practitioners, we have to be maintaining a certain number of points throughout the year in order to maintain our registration. This is their program. And so what the idea is to develop a learning program so that doctors learn how to refer to massage therapists and myotherapists instead of just doing the old reflex of just, as soon as something musculoskeletal walks in the door, okay, here's your referral to physio. Because quite often that's not what needs to happen. And so the RACG project is about teaching doctors to refer to us instead.
I love the term in some of your literature that you've been presenting to board about the whole project. You talked about the GP reflex.
Yeah.
I like that term. Explain.
Well, it is. You know, when the people go to the GP for a long time now have just thought, oh, okay, because they're in the government system, you know, they just think, okay, you got something wrong with you, I'll just send you off to the physio. And it's just been like that. It's automatic. And it's like, guys, just stop right there. You know, there are other options, especially now that we've got some health fund rebate recognition. So the ground is beautifully set for us to, you know, step up in the eyes of the GP and be a bona fide referral option.
Absolutely. Now, members should realise that members' funds have been used for a number of years via the association to assist in funding of research directly for massage myotherapy in this country. And interestingly enough, as part of your list of references, there was one that I did pay particular attention to because it did have the name John Adams in it as far as author. Now, John is part of Arkham. And it's sort of our contact to Arkham. Now, Arkham, most members should know about it because they would have read about it in articles, and you've probably seen John interviewed on Connect. But John is associated with a particular article that I came across in your reference list, which is titled "Referral to Massage Therapy in Primary Healthcare: a survey of medical general practitioners in rural and regional New South Wales, Australia. So this particular published research suggests that more than 3/4 of GPs referred to massage therapy at least a few times a year, but importantly, with 12.5% of GPs referring at least once per week. So this particular piece of research is looking at regional Australia, but surely that's reflective of all of Australia. And therefore, to sort of work out the numbers there, 12.5% of GPs all over Australia potentially are referring to massage. Now, it doesn't specify who's doing the massage, but as you're pointing out, a lot of that potential servicing is going to physiotherapy, maybe osteopathy and chiropractic, and not to actual massage therapists and myotherapists. Would you agree with that?
Yeah, and I'm thinking, that's got to change, and the way to do it is through education for the GPs. In the past, I've done RAC GP projects before, and they are very receptive to us. So there's no reason for us to feel inferior or lesser or what have you. The GPs are very keen to know about us and to work with us.
Yep, fantastic. So at this point in time, what's the future? What's the rollout for this particular project?
Well, it'll be over the coming year. I'm just in the middle of doing the needs assessment, and finding all that research was really good. So we'll do that. We'll sort out the need assessment, and then it's just a question of applying, and then getting the approval.
Fantastic.
Obviously, we'll be busy doing because we'll be developing an online project for them that sits on their RACGP website, so they can go in and they get points for doing the course, and then there'll have to be also a program at the same time teaching our members how to utilise that connection as well.
All right, fantastic. So hopefully out of this, there'll be some form of resources as well, as you just mentioned, for the membership, the member, the coalface, to actually approach GPs in a different way, hopefully a more successful way in allowing them to provide that service or being first on mind for the GP. Yeah, that's the whole.
So I'm a Massage and Myotherapy Australia registered practitioner, and I'm aware of what you've done, and so they can say, okay, so it's just like two pieces of a jigsaw puzzle going together, and they'll say, okay, so you're recognised, I've done that training, boom, there's the new reflex.
Yeah, well, it's a fantastic project, Raelene. So I think do you have an article coming up in the journal as well?
I do, and that is massaging the somatosensory cortex. I'm doing a master's in pain management, and everything is actually coming together now. So pain management is huge because there's such a massive, massive problem with pain looming in the future. The government have actually decided it's a bad thing, and so they want to start launching all sorts of initiatives to stop that looming pain crisis. So massage and myotherapy has to step up and take their place in that whole picture.
Okay.
They've got a lot to contribute, right from Cert 4 all the way through to postgrad. We've got a lot to contribute because pain management, a lot of it is about treating anxiety and depression. And if you read the journal article, you'll see that massage has a lot to offer for those particular people. You've got the myotherapist too, and the remedial massage therapist, and all of us, right from Cert 4 all the way through, are probably some of the most important practitioners in the pain management group. We have a lot to offer. Probably, I wouldn't say more than physio, but certainly on par. So, we need to position ourselves, and as being the peak body, we can do that.
Fantastic. Well, it's all ahead of us, Raelene. So again, many thanks for sharing what's going on in your world with the project and being a part of the association and being a board member as well. So you've got a lot on your plate. So we look forward to seeing how things progress throughout the year. So once again, thanks very much for spending a few moments with me.
Thanks, Dave.
Okay. Thanks, everyone. Cheers. Bye-bye.